GFAP and UCH-L1, blood biomarkers for assessing mild traumatic brain injury. GFAP, glial fibrillary acidic protein, and UCH-L1, ubiquitin C-terminal hydrolase L1. GFAP, glial fibrillary acidic protein, and UCH-L1, ubiquitin C-terminal hydrolase L1, are blood biomarkers that play a crucial role in assessing patients with mild traumatic brain injury, TBI. These biomarkers can be measured within 1 hour after a mild TBI and are particularly useful in distinguishing between patients with mild TBI and other trauma patients without acute brain injury. Here's how they contribute to patient evaluation. 1. GFAP, glial fibrillary acidic protein. Function: GFAP is primarily found in astrocytes, a type of glial cell in the brain. When there's brain injury, GFAP is released into the bloodstream. Clinical use: elevated GFAP levels are associated with intracranial lesions visible on computed tomography, CT, scans. It can help differentiate between patients with normal CT scans and those with abnormal findings. Sensitivity: GFAP is highly sensitive, ranging from 94% to 100%, in detecting intracranial lesions on CT scans in both children and adults. Predictive value: GFAP levels can predict which patients with mild TBI will require neurosurgical intervention. Specificity: GFAP is specific to brain injury. 2. UCH-L1, ubiquitin C-terminal hydrolase L1. Function: UCH-L1 is an enzyme found in neurons. After brain injury, it is released into the bloodstream. Clinical use: similar to GFAP, elevated UCH-L1 levels are associated with intracranial lesions visible on CT scans. It can also distinguish between patients with normal and abnormal CT scans. Predictive value: UCH-L1 levels can predict the need for neurosurgery in patients with mild TBI. Specificity: UCH-L1 is specific to brain injury. These blood biomarkers provide an objective measure that complements clinical decision-making, especially when determining the need for CT scans within 12 hours of injury. By assessing GFAP and UCH-L1 levels, healthcare professionals can better evaluate patients with TBI and make informed decisions about further imaging or interventions.